So yeah, so as Jane mentioned, my interest is in a system level change and intervention on the system level, but I also wear a clinician's hat and interested in sort of mental health. And today I want to sort of present to you a new service sort of intervention that's been introduced in Oxfordshire, but also talk broadly about children's social services. So I don't know how many of you are wearing the hats and are part of social services or interested in social care, but we'll be interested to talk about that after the presentation. As Jane mentioned, I am supported by an HR and this ARC, sort of Thames Valley collaboration, and that's where I've been based, as well as the Department of Experimental Psychology. I know we have 45 minutes. I'll see if I can do the 45 minutes. It might be shorter, and I'm sure you will appreciate that, as we always like to get some time back. So let's start. So I will talk about the history of safeguarding so that we all are on the same page, how it sort of got from regulation to improvement, then evolution of evaluation of children's social services, the model that's been implemented in Oxfordshire, and sort of my reflections on implementation and evaluation in the system level, and sort of future steps and ambitions and what hopefully I'm going to bring to the department. So let's start with the history of approaches to child safeguarding. So I want to start with this sort of policy timeline. And sort of the biggest shift started in the early 90s with the Children's Act that really put the sort of grounds for how protection of children should look like, what are their rights, what is the state responsible for. And then a decade later, there was this shift of multi-agency approach, and this document called Working Together came into place. We're looking at sort of an early birth of MASH. I do not remember, I think it's Multi-Agency Safeguarding Hub. That's what MASH stands for. But that's sort of an early birth of it, where police, health, school, etc. share the information and sort of funnel it down. Also, the framework for assessment, so how people use this framework to assess their risk and the need at the same time. Then we had sort of an update in early 2000s on Children's Act, and that sort of incorporation of the points I just mentioned, and the birth of Every Child Matters, again, including that they will have a right to education, they would have right to safe and caring place to grow, and additional sort of update after the Children's Act in 2004. Then I'm sure some of you who are from Britain would know that there were some tragic deaths that facilitated this government's report. So one of them was Lord Laming's report that really looked at the reality of children's social services and how such tragedies occurred and what could be done. And from that report, they sort of continued working on increasing the interagency responsibility and sort of even further updating that. Unfortunately, that wasn't sufficient as sort of 2 years later, there was another tragedy. And the Monroe's report was done to sort of look at how even further that can be improved. And that's where the shift sort of started towards the family, the whole family approach, instead of just concentrating on safeguarding and looking how to support the families. And from that, we have the sort of these working together documents coming up, and sorry, and then finally, the latest sort of update on the situation in children's safeguarding and policy was by McAllister, couple of years ago, where again it said that it needs to continue on the family approach, but also that it needs some again sort of revamping, because it's still not working. Lots of children end up being taken into care, so there is some need to reconsider things how are done so far. So that's sort of a landscape of children safeguarding and how it moved from safeguarding to more the family safeguarding. And yeah, just to emphasize that it was more protection and safeguarding in early 90s, and in 2000s it shifted to more working with the whole family. And what that meant for local authorities, that they had to sort of think, how do they address that? How do they start working with the families? And lots of different models or approaches. So I might use models and approaches interchangeably when I speak about this, were implemented and developed by local authorities and used to move the service to that direction. So I guess these categories these approaches can be grouped in different categories. So one is value-based. So that includes strengths-based approach, where concentration is on individual strengths and improving outcomes based on that, as well as relationship-based practice, which focuses on building relationship between practitioner, child, and their family. So that's one, value-based. And then the other one is theoretical, and theoretical is more like system-wide values, values-driven approach that looks at restorative practice, and that is sort of working with the families, providing the highest level both of challenge and support, and systemic practice, which focuses on the relationship between people and their social context. So the local authorities took these sort of system level approaches and tried to mix and match, as one might say, of seeing what fits best for them. So as a result, there has been a lot of different evaluations done throughout when these new approaches been implemented. And I'm just going to talk about the evolution of these evaluations. So basically, what we've done when we started working with the new approach in Oxfordshire is that we've done this narrative review where we try to understand, well, what is the landscape of evaluation of these family safeguarding approaches, as well as focusing on Oxfordshire's evaluation of the new approach. And I will present shortly about what we found on the routine data, staff and parents, and the ongoing. But let me start with the narrative review. So we, as I said, wanted to really understand what is the reality of evaluations of these new different models, because there is sort of very little understood how similar or different these practice models are, and what's the impact of these new approaches. So what we found, we looked at widely at the whole UK, and we found 30 papers reporting on 15 different approaches. Unfortunately, it's only England that sort of met the inclusion criteria. The other countries did not. So primarily the things that I'm talking about is about reports or evaluations on the new approaches done in England. So what we sort of found is that only 3 studies out of 30 really met the basic sort of research quality criteria. So using statistical significance or using statistical neighbors to sort of inference their findings, as that is not just due to chance, besides just saying, oh, we see change, but really not being very clear why they see the change. That's what I mean about the rest of the studies. So only 3 were able to really produce and show statistical significance, which again shows the sort of the reality of evaluations done on that sort of system level in social care. Parents also highlighted the importance of relationship building as a key element of all the various models. So I think, again, it is important to highlight that that's what parents want and need. 16 of these 30 studies reported mostly positive outcomes. So in the way they all were able to, in some respect, to show that there is change in children's outcomes, such as reduction in children subject to statutory plans, staff outcomes, so reducing the turnover, which we know plagues a lot the social care due to the intensity of work, as well as economic outcomes like cost and benefit analysis. However, the things we sort of thought needs improvement is that there's lack of consistency between the models. So if someone still uses the same theoretical approach, like value-based, it's very different if it's implemented in one local authority versus in another, even though on paper, technically, it should look the same. Many methodological concerns, as I mentioned, about just using the basic evaluation criteria. So therefore, the results really cannot be relied upon on the face value. Taken together, the findings sort of suggest limited good quality evidence to support use of any named practice. Most studies primarily rely on staff reports for the quality of their relationships with parents. So again, even though the reports say the parents really valued relationships, the source of saying that was staff. So again, gives a bit of sort of space to think how reliable that is. There was comparatively little information on children's experience, which I found quite fascinating because all is done about improving children's outcomes and children's experiences and, you know, getting them better childhood. But there is very little sort of feedback from children and their experiences, and if they sort of have that understanding that things are better now captured. Unfortunately, that wasn't captured. So when we started embarking on this evaluation of the children's safeguarding services in Oxfordshire, we really tried to sort of learn from the narrative review and work on improving our evaluation that it fills the gaps that were missing in previous evaluations. So, but just to take a step back about the Oxfordshire Children's Social Services and the model they implemented. So the model they implemented is called Family Solutions Plus. This sort of comes from a Hertfordshire model that's been sort of researched and well supported in that sense. And the key parts of that model is that it's a whole family care. So the service has sort of third sector coming in and supporting families with their needs that are sort of primary needs of these parents is substance misuse, mental health difficulties, and domestic abuse. Also, the model aims to reduce bureaucracy, so making more digital, less sort of paperwork, and trying to reduce the burden of bureaucracy so that social workers can spend more time with families and build that relationship. It is a strengths-based approach, so values-based approach, and sort of the key component of that is a motivational interviewing. So working on communicating and better engagement with families to elicit that change and build on strengths. And there's the multidisciplinary work. So the third sector is coming alongside the social workers together with the schools and other professionals involved, part of this so-called group supervision to reflect and collaboratively and discuss how the whole approach as agencies can involve in the family and take care and move and progress further with the family and support the family through the progress. So that's the sort of the parts of the model. So what we've done so far, we sort of started with the mixed methods evaluation. I have the protocol there if you want to read what we sort of said we will do and where we're at now. And we've done quantitative analysis. So we have done a sort of an initial when the model was implemented in 2021. We've done an initial analysis in 2022. that examined children's data. And what we sort of found that there is decreased time spent in service and reduction in number of care plans. We also done some qualitative studies of interviewing the social workers and parents and seeing what they see and how they experience the new service. And we found that provided sort of a deeper understanding of the family safeguarding plus and sort of the real world effects, or gave the context to the sort of quantitative analysis. So what did we find? So as I mentioned, we found that FSP managed to sort of reduce the time the children spend in service and fewer care plans. So meaning that they didn't go through step up or step down and, you know, left the sort of the service with fewer plans across. Despite facing more risk to begin with, so having more identified risk in the beginning. We also found that through the interviews that motivational interviewing underpinned the sort of collaborative nature between social workers and parents, and they were very much highly valued. And of course, it came with the sort of the drawback that parents said that there's still like consistency. So we sort of see that fidelity of the model wasn't fully implemented, as there were some experiences that were not consistent with the model. And unfortunately, by the time we tested, there wasn't a drop in children going into foster care, which was the sort of the key variable that everyone wanted to see to go down. But I'm just going to read the quotes. So one parent said, "I just felt completely listened to, supported, not judged. The suggestion that so this is the domestic abuse worker gave with certain things were really, really helpful. It was a lot of things I could pass on to my daughter. We worked a lot on confidence and being able to say no and self-worth. And the social worker noticed that I feel we are really able to offer a better, more holistic service to families, and that certainly makes my job satisfaction higher." So what does that mean? So these results sort of provide an insight on FSP, providing better experience for families and children compared to previous service. And they both sort of, social workers and parents welcome the increase in focus on supporting the whole family. And there is some evidence that FSP improves outcomes with less time spent in social service, even though it doesn't reach the sort of the ultimate outcome, reducing children going into care yet. I'll talk a bit more about the future, what we hope to see. So what are my sort of so far reflections? And I think working with social services as a researcher, and how this whole wide service change looks like, and what are the sort of the benefits of it and challenges for both sides. So what I've sort of observed for the services, the reality is there's no plan evaluation in advance. Things just sort of happen on the go. And they need quite a lot of support in that, as of course they are not research trained or minded, and evaluations is not a first or primary focus for them. There is that difficulty of implementing fully the approach without deviation because of real life and the context of real life. Not to mention, of course, the COVID-19, but in general, for example, the changing leadership team. So in the time that the new approach was implemented, there was a huge change in leadership that sort of had their own ideas what should be done about FSP, as well as resources and funding from the cabinet. What I found challenging as a researcher is that you really need to devote time to build partnerships. So you cannot just come and say, "Hi, I'm here to evaluate your new approach." You really need to listen to, be in those sort of meetings, and that might seem a bit frustrating because you're there to sort of do your job. But I found that building that partnership opened doors that probably wouldn't open if I didn't spend time building that partnership. Also, another sort of challenge or thing to learn is that research language is definitely not present, and need to spend time laying foundations for joint understanding of what really is required for evaluation, and help to build the next steps for research. So finding whatever you're finding, bringing back and making sure that you support them with how can it be adapted and what can be done to implement further, and work through of sort of troubleshooting where it works and where it doesn't. So it's sort of not a fixed experience that you implement and it's a smooth sailing. There's quite a lot of teething going on, and you need to support the service in feedbacking what you find, and supporting and seeing how can that be addressed moving forward. And of course, you need to have a very receptive heads of services who wants to hear their feedback that is not necessarily going to be only positive. And I think that's why building the relationship is important. Yes, so that's sort of my observations. What I've learned so far, as this is an ongoing project, we still have 2 years to go. But so far, it's, I would say, still quite important to build evaluation framework before the implementation of the new approach, so that everyone is on the same page, and have the same sort of key indicators in their minds, what they want to achieve, where this is going, and have that from the get-go. Using the findings, as I said, to adapt and direct the service. So striving for improvement, trying to really work as you go together as a team. And finally, sort of, again, importance of the local authorities' commitment to deliver high quality of care in pressure times. So I think pandemic is one example, but constantly ongoing, it's the budget shortages, change of leadership, management of resources, etc., that the authority wants to continue despite all of these pressures, is a testament, I think. And sort of what my sort of future steps are and ambition is that we'll continue looking into FSP, and we hope to map that data that we have now established with the local authority to map on the partners data, so police and healthcare, because from the Hertfordshire, where the model was developed, we know that they found that there has a sort of a trickling effect, reduced in police call-outs and emergency attendance. So we would like to see if that's seen in Oxfordshire. And now we are in the middle, actually, of the process of analyzing the 3 years of FSP and trying to mitigate COVID-19 impact, so that we can definitely see what's the trajectory of FSP when we move COVID-19 as sort of a covariate. Another big commitment of mine is to capture children's voices, again, based on missing those in evaluations before. I feel like it's important to see how children experience the service, and looking at service pressures and strategies used to manage children's social services. So this is another potential project that I hope to do, time permitting, as we've done very similar project with physical health on their pressures and strategies, and we found that there are some unwritten strategies that might be helpful to share across local authorities, that managers use to manage, and sort of build in, as nobody comes sort of trained to be a manager. Usually they sort of learn at the job at the get-go. And finally, trying to see, if possible, reviewing interventions and understanding the need of mothers with multiple childcare proceedings. So that's another sort of interest of mine, is mental health, and I would be interested to see what interventions are there to support mothers who had repeated children removed from them, as that seems to be quite an important objective for the healthcare going forward, is in identifying that need so far. So that's sort of, in a nutshell, what I hope to do. And yeah, I'll finish my sort of presentation here. Thank all these wonderful people from the local authority, as well as from the ARC, as well as from my team research colleagues who supported with, but most importantly, the social workers, partner services, and families, without whom this would not be possible if they didn't contribute their time and share their experiences. So I'll stop sharing, and I'm happy to take questions if there are any.